This is our patient. You can see the squaring off of her jawline, the pre-gel sulcus, the post-gel sulcus, and the hollowing in the preauricular area. She's complaining of sagging, and we want to try to fill these areas, fill the chin, the deflated chin, this preauricular area. And now I'm prepping with some HiPoCleanse. You may need to add some volume up higher in the cheek to lift that gel as well. I'm using a little lidocaine, 1% with epi, to make numbing dots so it'll be more comfortable for the patient. This isn't necessary, but good for new patients. I'm swishing next with 0.3 of lidocaine without epi, and now I'm starting the injection, a retrograde linear thread along the jawline and along the mandibular angle, staying in the subcutaneous plane, in the high subcutaneous plane. And you want to reflate the deflated chin, because the chin will look like a little knob by itself, and you can reach up and do the marionettes at the same time, and the pre-gel sulcus. So now we've got a smooth mandibular border. And now I'm going back to the mandibular angle, because you can put a lot here, 0.3, 0.4, to anchor that tissue back, and a little bit up along the lateral zygoma to lift up the gel. We need some height so we get tapering of the facial shape. And looking back, we can see we need a little bit more along in the post-gel area, and we can go almost a little bit underneath the mandible. So we want to increase the volume of that bone to get it the mandibular border nice and smooth, and then you smooth out with some ultrasound gel. And you get the lift, and you change the facial shape. This is our second patient. We're going to use supraperiosteal injections with a high G' hyaluronic acid. I'm marking the patient, and I'm going to backfill the syringe. This is such a nice way to inject these thicker products. This is actually Voluma. We're putting it in the insulin syringe, and you're right on periosteum. This is a very safe plane, right in the pre-gel sulcus where we've marked. Now we want to pull back in the post-gel sulcus. We want, again, right on the bone. This is a very safe plane. Again, you're not going to hit any vessels. Putting 0.1 to 0.2, and we want to elongate the bone, coming back to the pre-gel area and filling and making sure you get that just right, and filling the chin if you need to. Now, in this preauricular area, you're going to stay in the high sub-Q, because you're not going to do deep areas here, or you'll hit the superficial temporal artery, so no depots in the preauricular, and we're lifting, and we're just threading like we did earlier with the other product. And this will again help to lift the cheek, give that lifted, change the facial shape, that square, and give that nice smooth mandibular border just with 2 cc's of product.